Hi there, this is Dr. Hart again. Nursing with Hart PhD is my YouTube channel. Let's go over some test questions on depressive disorders. I covered depressive disorders yesterday in a lecture, so look out for that one. Number 1, the nurse assesses a client suspected of having MDD. MDD is major depressive disorder, so you have to know that. MDD or major depressive disorder is one of the common question types that I saw. So it is a popular topic when it comes to NCLEX style questions. Okay, the nurse assesses a client suspected of having MDD, which client symptom would eliminate this diagnosis. So you're looking for the answer choice that does not match with major depressive disorder. Letter A, the client is disheveled and malodorous. B, the client refuses to interact with others. C, the client is unable to feel any pleasure. And D, the client has maxed out charge cards and exhibits promiscuous behaviors. We'll give you a minute to think about this. While you're looking at those answer choices, if you are enjoying my videos, please like, share, and subscribe to my YouTube channel, Nursing with Hart, PhD. Okay, let's come back to these answer choices. The nurse assesses a client suspected of having MDD, major depressive disorder, which client symptom would eliminate this diagnosis. And the correct answer is letter D. The client has maxed out charge cards and exhibits promiscuous behaviors. So this symptom, spending, excessive spending, and promiscuous behaviors would be like high-risk sexual behaviors and excessive shopping or spending. Those are more symptoms like a manic behavior from a bipolar manic behavior, okay? Those are not typical symptoms of a depressive disorder. Okay, so let's look at the other answer choices. Letter A, the client is disheveled and malodorous. Yes, those do match, so that would not eliminate the diagnosis. So it's not letter A. Someone who is suffering from major depressive disorder would be disheveled, the hair is messed up, the clothes are dirty, they haven't showered, so they have a malodorous from body odor. Letter B, the client refuses to interact with others. Yes, that matches with MDD or depressive disorders, where the client is sometimes isolating, going through social isolation, not wanting to talk to anyone. Letter C, the client is unable to feel any pleasure, and that is another sign and symptom of major depressive disorder. So you really have to know those signs and symptoms for this one. Number 2, a client who's taking fluoxamine or Luvox without significant improvement. As the nurse, I heard about something called MAOI. Can't my doctor add that to my medications? What's the most appropriate nursing reply? So here you have to know generic for your NCLEX, generic and brand names. You have to know both of those, because sometimes it will have one or the other, sometimes it'll have both on these test questions, and sometimes it will even tell you what they're taking the medication for, but you still have to know brand name and generic. Okay, so fluoxamine or Luvox is an SSRI, which is a selective serotonin reuptake inhibitor. That's an antidepressant. And I talked in my lecture about the problem with mixing SSRIs with MAOIs. Here are the answer choices. Letter A, this combination of drugs can lead to delirium tremens. B, a combination of an MAOI and fluoxamine can lead to life-threatening hypertensive crisis. Letter C, that's a good idea. There have been good results with a combination of these two drugs. And letter D, the only disadvantage would be the exorbitant cost of the MAOI or high cost. Okay, so the correct answer on this one is letter B. Okay, the nurse should explain that combining the MAOI and fluoxamine, which is the SSRI antidepressant, can cause a life-threatening hypertensive crisis. And just for FYI, symptoms of hypertensive crisis are severe occipital in the back of the head or temporal pounding headache with occasional photophobia, sensation of choking, palpitations, and a feeling of dread. And that is can develop into a very serious life-threatening crisis. Okay, so let's look at why the other answer choices are not correct. Letter A, this combination of drugs can lead to delirium tremens. That is not true. Letter C, no, it's not a good idea to mix SSRIs with MAOIs. So in this case, you definitely have to know what is Lovox. You have to know it's an SSRI. And letter D, the only disadvantage would be the cost. And that is not true. Next question. The psychiatrist prescribes an MAOI for a client. Which foods should the nurse teach the client to avoid? You notice a pattern here. I did talk a lot about MAOIs and the contraindications for MAOIs, which are monoamine oxidase inhibitors. Okay, your answer choices are pepperoni pizza and red wine, bagels with cream cheese and tea, apple pie and coffee, or potato chips and diet cola. I'll give you a minute to think about this one. All right, let's come back. So which foods should the nurse teach the client to avoid who is taking an MAOI, which is a monoamine oxidase inhibitor for depressed mood? The nurse should educate the client to avoid pepperoni pizza and red wine. So the correct answer is letter A. Clients taking MAOIs should not eat foods containing tyramine. So you have to know what foods contain tyramine. These are aged cheeses, red wine, beer, just say any alcohol, chocolate, smoked and processed meats. So any of those. So pepperoni pizza and red wine is alcohol, and that's a smoked processed meat, the pepperoni. Okay. So you would not, if your client is taking an MAOI, you have to teach them to avoid those types of foods. Okay, let's look at the other answer choices. Bagels with cream cheese and tea, nothing with tyramine. Apple pie and coffee, that's a good one. Those are good to have. Potato chips and diet cola are good. So the only thing here that has tyramine in these foods is pepperoni pizza and red wine. Foods with high tyramine content can induce a hypertensive crisis within 2 hours of taking them with the MAOI. Next question. Which client information does the nurse need to assess prior to initiating medication therapy with phenelzine, brand name Nardil? Okay, again, you have to know what phenelzine or Nardil is. This gives you phenelzine is the generic name, Nardil is capitalized, so you know that's the brand name. There can only be one generic name, but there can be multiple brand names, okay, for each medication. Okay, let's look at the answer choices. The client's understanding of the need for regular blood work. B, the client's mood and affect score according to the facility's mood scale. Letter C, the client's cognitive ability to understand information about the medication. Letter D, the client's access to a support network willing to participate in treatment. All right, we'll give you a minute and we'll come back. Okay, and the correct answer is letter C. The client's cognitive ability to understand information about the medication. So that's what the nurse needs to assess prior to giving the phenelzine or Nardil. What's phenelzine? Brand name Nardil. This is an MAOI, or a monoamine oxidase inhibitor. Again, this is the medication that should not be taken with foods that are high in tyramine. Okay, so the client has to be cognitively aware in order for you to educate them about the medication. Very, very important with any medication. So the correct answer is C. The client has to have the cognitive ability. Let's look at the other answer choices. Letter A, the client's understanding of the need for regular blood work. Blood work typically not needed on antidepressants. But when I get to psychopharmacology, there is a medication particularly used for bipolar disorder, which is lithium, that does require regular blood work. I'll get to that shortly in a future video, so look out for that one. Letter B, the client's mood and affect score according to the facility's mood scale. Okay, you really don't have to know a mood scale before starting phenelzine. And letter D, the client's access to a support network willing to participate in treatment. Okay, all clients should have a support network. Doesn't have anything to do with phenelzine. Next question. The nurse is implementing a one-on-one suicide observation level with a client diagnosed MDD, major depressive disorder. The client states, I'm feeling a lot better, so you can stop watching me. I have taken up too much of your time already, which is the best nursing reply. And there's a very, very important clue in the stem of this question that the client is saying to you. And you have to be able to recognize that. Take a close look at it. Here are the answer choices. A, I really appreciate your concern, but I've been ordered to continue to watch you. Letter B, because we are concerned about your safety, we will continue to observe you. Letter C, I'm glad you're feeling better. The treatment team will consider your request. And D, I will forward your request to the psychiatrist because it is his decision. Okay, we'll give you a minute and come back. Okay, let's come back to this one. Let's look at the stem of the question again. Let's look at what this client is saying to you. The client is saying to you, I'm feeling a lot better, so you can stop watching me. I've taken up too much of your time already. What the client is saying to you is they're feeling better. They've been on antidepressants, and I talked about this in the lecture content. Once the client starts on an antidepressant, they may begin, the mood lifts, they may begin to start feeling better, so those suicidal thoughts may become an action. Now they have the mood has lifted with the antidepressants. Now they may have more energy to carry out the suicidal thoughts they've been having all along. So that's a clue, feeling a lot better. So what they're saying is, I'm feeling better. I have the energy now to carry out my suicidal thoughts. Okay? You have to read into that. But if you are caring for patients with depression, the things that they can say, any patient with the things that they can say, you have to read between the lines. Okay? So the correct answer is letter B, because we are concerned about your safety. The word safety is in the answer choice. This is a safety question. We will continue to observe you. Okay, the carrying out of a safety plan is actually can be a nurse function. Okay, if you're caring for patients with depressive disorders and you feel they should be on a safety plan, you can call the doctor, get that order. You can begin that, get the order later on. But the important thing is to keep the patient safe. So they should be on a one-to-one observation if they are expressing suicidal thoughts. That one-to-one observation is going to be with a tech or a nurse, some healthcare provider that's going to be at arm's length, okay, so that that person can be observed 24/7, okay, until such time as the psychiatrist comes and does their assessment, and maybe they might lift that observation order. Okay, the next, where was I? Oh, and the letter A, I don't like it the way it's worded anyways. I've been ordered to continue to watch you. That's disrespectful way of saying it. And think about your therapeutic communication when you're reading these responses. Letter C, I'm glad you're feeling better. The treatment team will consider your request. No, you're not going to do that because the client is telling you, I don't want to be watched because I have plans, okay, in my head of trying to hurt myself. So, and letter D, I will forward your request to the psychiatrist because it's his decision. No, you're not going to do that either, okay? You're going to continue to watch that patient. A psychiatrist will come and assess that person and go from there, okay? Do not lift that one-on-one suicide observation, okay? Next question, which client statement expresses typical underlying feelings of clients diagnosed with major depressive disorder? All right, letter A, it's just a matter of time and I will be well. Letter B, if I ignore these feelings, they will go away. C, I can fight these feelings and overcome this disorder. Letter D, nothing will help me feel better. Okay, I'll give you a minute to think about these. This is something else I covered in the lecture. All right. Okay, and the correct answer on this one is letter D. Nothing will help me feel better. So the typical underlying feelings of a client diagnosed with major depressive disorder. Typical underlying feelings. Typical underlying feelings of someone with major depressive disorder are hopelessness and helplessness. Okay? Nothing is going to help me feel better. That's a hopeless statement. And so that is the correct answer. Let's look over these other answer choices. A, it's just a matter of time and I will be well. No, that's not a typical symptom of major depressive disorder. Letter B, if I ignore these feelings, they'll go away. No, that's not typical either. And letter C, I can fight these feelings and overcome this disorder. That's too optimistic. That's not a typical symptom of major depressive disorder, okay? They are they're displaying hopelessness and helplessness. Those are typical affective symptoms of clients diagnosed with major depressive disorder. Last question. A nurse is caring for 4 clients taking various medications. Oh boy, you have to know these. Including I'm going to do my best to pronounce these. I know some of them are very hard, but guess what? For your NCLEX, you don't have to know how to pronounce them. You just have to know what they are in the test question, right? Once you're in your practice, in your nursing practice, you're going to hear other nurses stumble with these names too, okay? You may hear nurses use just the brand name, okay? So imipramine is tofranil, doxepin is Sinequin, ziprasidone is Geodon, and tranylcypromine is Parnate. The nurse orders a special diet for the client receiving which medication? This is the same thing that I talked about before with, think about what I talked about with MAOIs. Try to figure out which one is an MAOI, what's the concern. Okay, so which medication requires a special diet? Tofranil, Sinequin, Geodon, or Parnate? Okay, let's come back. And so which medication requires a special diet? Okay, letter D is the correct answer. Tranylcypromine or Parnate is an MAOI or monoamine oxidase inhibitor. The hypertensive crisis can occur in clients receiving the MAOI who consume foods or medications with a high tyramine content. And I talked about those. H cheeses, smoked meats, pepperoni, any alcohol, things like that, right? Smoked sausage, high in tyramine. Okay, let's look over these other answer choices. Letter A. Okay, letter A is imipramine or tofranil. Imipramine tofranil is a tricyclic antidepressant or TCA. Okay, there is no diet, typically no diet restriction with that. Letter B, doxepin or Sinequin. Okay, doxepin. Sinequin is also a tricyclic antidepressant or a TCA. No diet concerns there. Letter C. Ziprasidone or Geodon is an atypical antipsychotic medication used to treat schizophrenia and bipolar disorder. Okay, so when I get to the psychopharmacology content, I will be talking about these. All right, and so that's it for now. Have a great day, everybody.